There we go. Now I got it to work. So I'm Barbara DeMaio, as Carolyn just said, and I'm going to talk a little bit about what happens as we age. And I'm really happy that my colleagues already mentioned some of the things that I'll be talking about in particulars because I was going to have to explain what an SOVT was, and now I don't have to. So, what happens as we age? Well, the hyoid bone, which is what the larynx is hanging from, it starts to ossify around the age of 2. When you come to the birth canal, your entire larynx is soft like, cartilage. It's just all soft cartilage. And that's how you can get through the birth canal. The cricoid and thyroid cartilages, which are the two big parts of the voice, that we think of the thyroid cartilage is on the front, and it's called that because the thyroid's around it, and the cricoid is like a big ring that's at the bottom of the larynx. So what does that mean? That means that the stronger they are, the more they're ossified. That means the more that the vocal folds, the more support that the vocal folds have. So this is one of the reasons that people with big voices, we think this is one of the reasons that people with big voices take a little bit longer to mature, because it takes a while for those cricoid and thyroid cartilages, which support the vocal folds, to get hard enough to support big old fat, great big dramatic voices. So the ossification of the cartilage can be a good thing, and that's because, as I said, when the ossification is in there, it does a lot of good things. For example, we have a thing that happens in children. Children can sometimes have a kind of a breathy sound. That's called a mutational chink, which means it's a chink that forms in the vocal folds as they're growing. And that's because those cartilages are not quite strong enough to bring the vocal folds all the way together. So it's very important that you let a child sound like a child, because if you try to make the child sound like an adult, they're going to put extra pressure on those vocal folds, and it's very bad for the larynx, and it can affect their speaking and singing voice as they're older. So the arytenoid cartilages, they ossify in the early 30s, and that in fact is when bigger voices begin to mature. So hormones. I like to say that the vocal folds are a female instrument because they have estrogen receptors on them. So when those estrones, which is what we think of as the female hormones like estrogen, are replaced, those receptors start taking in androgens, which are like testosterone, those male hormones. The vocal folds develop a thicker covering or epithelium, and the cartilage starts to ossify at a faster rate. Now, this happens in boys when they go through puberty, but women, it doesn't happen until menopause. So when boys experience the loss of estrogen, they also have a growth factor that's going on, but women don't. And so it can cause a lot of not very nice things to happen to the vocal folds and to the larynx itself. And that's one of the things I'm talking about. So hormonal changes will affect women throughout their lives. They're really apparent in men at puberty, but women have hormonal changes during menstrual change and pregnancy. So we are kind of like a hot mess of hormones for most of our lives. Some women will experience a temporary vocal lowering, and that's not just your singing voice, it can also be your speaking voice on your days prior to menstruation. And they've actually done research projects where they've had men listen to voices of women, and they can tell between the time that they are in their menstrual period and when they're not. It makes that big of a difference in the sound. And they have found that some of the third generation birth control pills, which are pretty much what everybody uses right now, can dampen those hormonal swings. Now, I will tell you that when I was a young girl, which was a while ago, and they had hormone pills for birth control, they had so much hormones in there that it would actually could affect, for me, it made the passaggio or the break in the middle of my voice bigger, but for a lot of women, it caused them to lose their top notes. But now they've worked that out and they've got them more even. So this type of birth control we have now has less effect on the voice, which is a good thing, obviously. So what happens with these hormonal effects? So when estrogen leaves the building and when progesterone says bye, which is what happens in menopause, there's often a poor response time in the vagus nerve. What's the vagus nerve? Well, it's also called the vagus nerve, but I like vagus because it's Latin. But at any rate, that's the nerve that tells your vocal folds what to do. And as you get older, that nerve kind of gets like a frayed electric cord, and it doesn't carry its message as well as it needs to. And that is also affected by that lack of estrogen and progesterone in females. The thickening of your vocal fold epithelium is a big deal. That happens in men at puberty, but in women it doesn't happen until that menopausal time. And that's one of the things that causes problems. You can also get atrophy going on in your vocal fold area, which is not a great thing. Vocal folds are muscles, right? So if you don't use your muscle, what happens? It starts to get weaker, it starts to atrophy. Vocal fatigue comes along, and Rinke's edema, what is that? Well, that's that top layer of your vocal folds gets swelling. And it happens a lot with smokers, but it can also be caused by menopause and those hormonal changes. They don't really know, scientists are not really sure exactly what's caused by hormones and what is normal aging, or presbylaryngeus. That's a fancy name for it. But they did find that 20% of professional singers in recent studies had menopausal symptoms serious enough to merit treatment. I am one of those singers. I am on hormone replacement therapy for that very reason. And that's why I did my dissertation on it. So presbylaryngeus in both men and women can cause changes in your laryngeal cartilages and joints, once again, because that cartilage is hardening and hardening, because your larynx only has one bone. It's that hyoid bone. Everything else is cartilage and musculature and no bones. So it can also affect that intrinsic inside laryngeal musculature. And once again, the vocal folds of both men and women can be affected. And laryngeal innervation, that's what I was talking about before. It's that vagus nerve begins to kind of fray, as it does in both men and women. And that ossification can be beneficial if you are in your 30s or 40s. It's not quite so beneficial when you're older. So how do you take care of the voice? A lot of common problems have been answered by Edri's talk, so I'm really happy about that. Tension in the neck and tongue is very common in older folks. Pitch matching can be affected. It can be caused by a loss of hearing, but it can also be caused by the fact that your voice doesn't feel the same. So singing and speaking is partially a biofeedback mechanism. You kind of know where it goes. And as you get older, that feeling changes. It can change the range at the top or the bottom of the singing voice in both men and women. And those passaggio problems, that's where the voice kind of hooks together between head and chest. That specifically in women can change. Where it changes over can change. So when I was younger, my passaggio was around an E flat. And now it's just a little bit higher. It's like an E natural. And that is something that's very common. So also an uneven vibrato or your wobble in your speaking and your singing can come along, especially if you're somebody who's used a lot of tension in your singing or speaking during your life, because you kind of wear out these little muscles that are here in the larynx. Men can lose their falsetto, which you don't want to have happen because that can affect your voice as well. Your breath management can get worse because, once again, your muscles are getting older and they're losing some of their muscle tone. And then a very fancy word, verbal diadochokinesis. What does that mean? Verbal diadochokinesis is when you have trouble going from a consonant to a vowel, or when you can see the word but you can't get it out of your mouth. That's very common in aging, and I'm experiencing it right now, as most people are as they get older. So why does pitch cause problems? Why can you lose pitch matching? Now, I know this is about speaking voice, but if you're a preacher, you're going to be singing hymns. And I actually had a friend of mine who is a preacher come to me to work with me because she didn't have enough range to sing hymns anymore. And so that same things that was causing her range problems can also cause pitch matching in some singers. Hearing aids can also be a problem. So if you have hearing aids, one way I've found to solve that is to take your hearing aids out and learn to feel what your voice feels like now. And then when you put them back in again, it'll be easier to find that biofeedback mechanism that gives you the right pitch. So it's very common to lose the feeling of chest and head voice. So you must pay the rent. I can't pay the rent, chest and head voice. And those feel different as you get older. So it can also affect your speaking voice, as I will talk about soon. And the point is not to fix your voice, but rather to recalibrate your voice. You're never going to sound like what you did when you were 25, but we can find a way for you to use your voice as efficiently as possible now. So in singers, sopranos can lose their top notes. Some classical mezzos can lose their lower range. And I think that's because it feels different where the head and chest are. I think that's what causes that. Your female optimum speaking pitch can lower. So your optimum speaking pitch is not unlike what Edri was talking about with resonance. You can also find it with saying something like, yum, 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 and that's about where you should be speaking all the time. Now, if you're like me, you start speaking like this when you're tired. But you should be speaking up here. It's lighter, it's more resonant, it's easier to make it get out there in the world. Men also can lose range and vocal power. They can get a softer, higher voice. I'm sure you've all heard somebody in their 90s, a male person speaking in their 90s, whose voice is weaker. That's one of the things that can happen to men as well. And it's important to use your voice every day in order to avoid the atrophy of the vocal folds that can lead to actual vocal bowing. What's vocal bowing? That's when they don't meet in the middle. They actually don't quite meet, and that can be part of what causes that higher, lighter sound. So stretching the voice in both directions, that's what Edri talked about. There's other things you can do, sirens and whoops, like woo, stuff like that. That's also great. You don't have to have a piano for that. Vocal fry into pitch. Edri was talking about vocal fry, so it's another way to find your chest voice. And this is something that I just learned from Diana Orbello from the Mayo Clinic. It's a gargling exercise. So this is something that will reduce throat tension. And what you do is you take a small sip of water, and I'm going to do it for you. You can't gargle if your throat is tight. And so it's a great exercise if your voice is tired. Other things that help a tired voice are the SOVTs that Edri talked about, straw phonation, lip trills, etc., that were very well explained already. And don't forget that the speaking voice has to be supported just as energetically as if you were singing opera. It's got to have a nice energetic, you don't need as much air to speak as you do to sing opera, but you still need to have an energetic and support with lots of intercostal muscles and all those things. So what is uneven vibrato or the wobble caused by? Well, our muscles are losing tone. So both the outside and inside, the extrinsic and intrinsic laryngeal and vocalis muscles, vocalis, that's another road for your vocal folds, can weaken, and that can lead to a vocal instability and an uneven vibrato, and that can happen both in the singing and the speaking voice. So you need the right kind of tongue tension. In other words, the kind of tongue, you need a little bit of tongue tension to articulate well, but you don't want the bad kind of tongue tension, and that's what you can get rid of with those tongue stretching exercise Edri was talking about. There's also some onset exercises that can strengthen the way those vocal folds snap back together, and a doctor named Stimple put some together, and it's really pretty simple. It's just, you can use a straw for it. I've also got a straw here, and the idea is to do a clean onset. So, because if you can do a clean onset like that, that's strengthening the muscles as they come back together. And you'll find that if you are having some kind of a wobble, it'll be hard to get a clean onset. It'll be kind of like, or yeah. So, mm, mm, that is a clean onset, and that's one thing that will help strengthen those and help with this issue, especially when you're talking about essential tremor, which is another thing that happens as we age and which affects, once again, both the singing and speaking voice. So let me talk about diadochokinesis for a minute. Tongue twisters, as Edry talked about, are also very useful, not just for warming up the voice, but also for helping when you begin to have those problems saying what you're trying to say, because our articulators begin to lose their muscle tone as well. So these are some of my favorites. 9 nice nurses nursing nicely. My mother makes marmalade. Many men mention Mary. 33 thieves thrilled the throne. You can see it's all using different parts of your articulators. 6 sick hicks nick 6 bricks. That's a good one. Betty bought a bit of better butter is one of my favorites as well, because that warms up your lips. And all of those are great for aging voices because it gets the articulators going, but they're also good for people that aren't aging, as Edry pointed out. Physical fitness is very important, not just from the throat up, but the entire body. As you get older, it's extremely important to keep using the muscles of your entire body, because that's what's going to support your speaking and singing voice as well. So I have a couple of breath exercises I want to share with you. If you push against the wall using your hands about at waist level, you will feel those intercostal muscles that are right here in the back. I'm like, you can see me doing this, I'm sorry, but they're right in the back of your rib, where your ribs open and close, and you can feel those opening while you're pushing against the wall. Another way to take a breath and get a nice deep breath is imagine that your shoulder blades are wings and that they're actually opening up. So when you take a breath, that'll help your back to open up, and once again use those intercostal muscles better. I like to use a stretch band like you use in working out around the ribs, because that really helps me develop that rib action of opening. And then, of course, there's the breathe in 5 counts, hold for 10 counts, breathe out for 5 counts, which you probably have done if you've ever been in a choral situation. That's also good for mindfulness, by the way, which I'm going to talk about in a second. So, tips for keeping your speaking voice healthy. You want to be sure to speak at your optimum vocal pitch with that nice resonance all the time. If you're a teacher who's speaking all day long, you need a personal amplification device. Now, they come around and in your front, just like as one of my teachers said, oh, I look like Britney Spears. Yes, well, indeed you do. But you then have a little speaker that hangs off of your belt, and that keeps your voice from getting tired. So you need to remember to breathe and support your voice when speaking as you would when singing. I know I've said that before, but it's good to repeat it. When your voice is tired, reach for a straw. Those semi-occluded vocal tract exercises can also help release those intrinsic vocalis, the intrinsic muscles of the larynx. There, I said it. I told you, diadochokinesis. And that will help your throat to release, so you lose that tiredness. Also, the gargle exercise I just told you about, that's another great one for a tired voice. If you're using your voice all day, as teachers do, or for an extended length of time, as preachers often do, find some moments during the day to take vocal breaks where you don't talk. You just let your voice chill. That's very important for keeping a healthy instrument. So, in both singing and speaking, it's a use it or lose it proposition. You need to warm up the voice before speaking or singing, and you need to do it every day. And you need to do exercises like, if you're a singer, some kind of repertoire, like a song. But if you're a speaker, doing tongue twisters is a great way to warm up those articulators. And in my study on menopause, I found that the dryness and vibrato issues are part of normal aging in both men and women. But participants that were not on hormone replacement therapy reported their loss of flexibility and passaggio issues and loss of range. Those are things that happened in all of the women that I interviewed that did not do hormone replacement therapy. And I think that's all I had to say, except I said I was going to say something else, but I'll think of it later and I'll come in. So, the important part of all of this is to keep using your voice.
Thank you so much, Barbara. That was really wonderful. And I'm sure there'll be a lot of questions from our listeners when we get to the Q&A, because I have a one for you right now, but we'll save that for later.